Are you still tired even though you use your CPAP every single night and you're waking up unrefreshed in the morning? Well, if so, then this video is for you. It's time to uncover some of the reasons why this potentially could be happening to ensure that you are getting the sleep that you need. Hi, I'm Dr. Val, an integrative sleep medicine physician and women's sleep expert, here to discuss why you're still tired even though you're using your CPAP. First off, let's talk about CPAP related issues. Number one, you may just not be getting enough pressure. Suboptimal pressure can lead to not fully treated sleep apnea. What do I mean by that? Well, if you've already had your diagnostic test, your AHI or your apnea-hypopnea index was greater than 5. Goal is to have this less than 5. However, if you're still having 3 or 4 events per hour, that potentially could be still noticeable. And you may need more pressure in your machine to help keep your airway open so that you can rest peacefully. Another issue that I see pretty commonly in my clinic is just the mask is really uncomfortable. You may be fitted well when you're upright and, when you went to talk with your medical supply company, but at home, if you're on your side or maybe your pillow isn't quite right, then that can lead to your mask shifting and then also some difficulty with your sleep quality. Another reason that I have patients come ask me about is that there's just too much pressure blowing in their machine. In the beginning, they start off, it's great, they have their ramp really low, and then as the night goes along, maybe they wake up and they feel like they're in a wind tunnel and they have to go to the bathroom because that wakes them up, and then they try to put the mask on and just way too much pressure. This especially happens in folks who can have a mask leak, or if you're on an auto-adjusting machine and it's driving more pressure to overcome that leak. What can happen is, think of it like jet liftoff. The mask can actually lift off your face and can feel super uncomfortable. So narrowing the ranges of pressure can certainly help. Another concern that I often hear is I wake up and there's so much moisture in my mask. We have condensation, and this happens if you're using your humidifier. And note that you don't actually have to use a humidifier. It's only for comfort. It doesn't really help at all to reduce your events per hour number, but if you have a dry mouth, then it could really, really help. And so what happens if there's just too much humidification in the hose as compared to the ambient temperature in your room, it can cause rain out. So what are 2 steps that you can do is actually put your machine lower than your head of the bed. That can help. Let gravity pull down the condensation, or just turn down the humidification levels. There's 2 features that you can turn down: the temperature for the heating plate and also the temperature in the hose. Yeah, little tip there. Other reasons that you may still be tired even though you're using your machine and everything is working well with your CPAP, maybe you're not getting enough sleep. Most people need between 7 to 9 hours of sleep, and oftentimes I see a lot of people that get 5 or 6. Try getting more sleep. I know this can be super challenging depending on your job and your family life. I always encourage people, maybe just a half an hour or 40 minutes longer. Maybe just that 30 to 40 more minutes of sleep can make you feel so much more refreshed in the morning. Another thing to think about is your stress level. Even though you are able to fall asleep and you can sleep with your machine on, sometimes people come and tell me that they just wake up before their alarm and they can't go back to sleep. So if you're waking up because you're worried about something, or if you have a lot on your mind, see if you can talk to someone about this. And if you don't like talking to therapists, there are certainly options. There's like a lot of AI apps that you can use to help. Another thing that you can try doing is just jotting down what's on your mind for a couple minutes throughout the day on a regular basis. That's one of my favorite stress busting tools. Another thing that can impact your being able to feel refreshed in the morning is other medical conditions. As we get older, oftentimes people who have obstructive sleep apnea already have diabetes or high blood pressure or maybe some arrhythmias, and those things in and of themselves can cause some disrupted sleep, or even the medications that doctors give you to treat those conditions. Another thing actually is another sleep disorder. Maybe you may be kicking your legs at night. We call that periodic limb movement disorder. Or some folks can have obstructive sleep apnea and also have narcolepsy. And narcolepsy is a condition where, regardless of how much sleep you get, you're still pretty tired. So if that's the case, ask your doctor to send you to a sleep specialist to learn more about other medical sleep conditions that can be disrupting your sleep. I hope you found this video helpful. If you'd like to learn more about women's sleep and full living, please look at the link below. It'll tell you more about a membership program that we have at Sleephoria, and it's on the platform school. Until next time, ladies, sleep well.